the post-op day 1, we actually do post-op classes where we bring all of our patients in and we review all of the instructions that they have been given. We also talk about the importance of having this beautiful cataract surgery, and now they are a part of the results, that following those instructions on especially their medications and the use of their tears is going to help their outcome. Because the doctors can do a beautiful surgery, but without their doing their part, then there can be a problem.
Hopefully we were able to reassure you that that process wouldn't be too difficult for you, and
Yes.
it sounds like it was.
It's so simple. I mean, you come in and you get it done, you go home, you look normal. So easy.
I think it's very important that the educational part is for everyone, whether it is with the people on the phones, the insurance department, your patient care coordinators. You have to have a continuous comment or education. Everybody's saying the same thing. They'll get their vision checked, they have their pressure checked, they're checking the first eye surgery, they're going to get a refraction, then Dr. McCabe's going to examine them with the slit lamp, and then they're going to talk about any concerns or questions that the patient might have, and then we answer those, and then they're going to see a patient care coordinator again to go review all of their instructions for the second eye.
Hi, how are you doing today?
Good morning, doctor.
Good morning. Good to see you.
How are you?
I'm doing great. So what do you think so far?
I love it.
Yeah. So today what we're going to do is kind of see how you're doing with this first eye. And from there we can make a decision about what we want to do with your second eye, okay?
Okay.
And the reason I'm having you do that is because this is kind of a test of how you're doing with your near vision on your first eye. So if you tell me that you're having to hold this out a little bit further than you would like, or that you wish you could see a little bit further down on the card, we have a choice to make with your second eye. We can either match that up with what you have right now, or we can actually boost up the reading portion a little bit. So how do you feel about the distance where that's clear for you?
About right there.
And do you feel like that's kind of a comfortable distance, or do you wish you could read a little bit further down on there?
I would like to be able to read this one. I can read this one pretty good.
Right. But you're hoping for a little bit more, maybe a little bit finer details there. And do you spend much time reading? A lot. Okay.
Three books a week.
Oh, wow. That's awesome. So
it's important to me.
Right. So we can do that. What we'll do is we'll choose a different lens. It's very similar to the one you have in your right eye, but it will give you just a little bit more in the reading power for your left eye, okay?
Perfect.
So both eyes together, you'll see great at distance, and you'll have a little bit more independence near.
Okay.
All right, well, let's go ahead and take a peek. So it looks like you're doing great here. Your eye is just a little bit dry. So that's a common thing after surgery because we've made some incisions and that cuts through some of the corneal nerves. So what I'd like you to do is increase your lubricating drops, and that'll make your vision just a little bit sharper, and it will stop some of the fluctuations you may be noticing. So that all looks great. Nice clear cornea, just some SPK inferiorly in the right eye. He has an LRI nasal and a perfectly centered restore with a clear capsule. And still has a cataract in the left eye. Looking good. So the next step will be that we get you over to see our counselor again. They'll remind you of all the things that you need to do prior to surgery. We'll make sure that we have the right surgery date scheduled for you. And I'll see you, and we'll go ahead and match you up, but just give you just a little bit more of the near.
Perfect.
Okay? All right, excellent. Good to see you today.
Yes, as always.
Do you have any questions for me before we get to it?
I have no questions. I just want to thank you for your expertise. It's been a pleasure dealing with everybody here.
So what's different now that you had cataract surgery? What are some of the things you can do easier? What was your experience right after your surgery?
Just live life. Just don't have to worry about glasses, contact lenses. I just love it. It's just worry-free. They're just worry-free.
Yeah. There's one less thing you have to consider in your
That's
day,
right. One less thing, you have to worry about your clothes or your makeup or your smile or whatever. And then eyes, don't have to worry about it. They are just there.
Doing their
they
job.
Work and they do like you're young, and it makes you feel like you're more confident.
I was having difficulty wearing glasses when I walked. And then, of course, at night driving, I couldn't do that anymore. When I first met Dr. McCabe, She was very, very kind, very calm, which really made a difference for me. Before I came in for my surgery, I was somewhat nervous because I was concerned about what the process and the procedure was going to be. Was going to be any pain or the whole bit. But when I came in, everybody seemed very nice and friendly, and they just put you through all the process, and you went into the surgery room. They relax you a little bit, and then you go right to surgery, and it was a lot easier than I thought it was. Life's too short. You know, you have to be able to see. It's so important. And why wait till when you're older where you really can't see very well, and why go through it then if you can do it earlier? I just feel privileged to be able to have this done.
In my life, I do restoration on paintings and things, and if you have ever seen an old, like, Renaissance painting, and there have been some, I think the Mona Lisa was one of them, where they did some restoration and they showed you where it was half cleaned and half uncleaned. This side is unclean. This side is clean.
You've been restored in that.
I've been restored, and it is such an incredible difference. I mean, I had no idea that I was that bad.
Mm-hmm. How's your distance vision doing?
The distance vision, I've been nearsighted all my life, and anything beyond about here, all my life, I've had to have prescription lenses for. I can read street signs without my glasses with this eye. Not with this eye still.
Hi, Mr. Spiller. My name is LaVon. I'm one of the patient care coordinators. We're just going over some information today about your upcoming surgery. Now, this is a copy of your pre-op instructions. You're going to take this information home and read it over. Now, the 3 drops that you were prescribed for that first eye, you're going to do the same thing for your left eye as well.
When I came in here, I didn't know what to expect, and been putting it off for 2.5 years. And the minute I came through the front door, they made me feel comfortable. They're respectful. I've never seen such a bunch of professional people. I've never dealt with anybody like this.
Well, I think our culture is really what sets us apart. There's a lot of great surgeons, but our staff buys in. It's almost like they're partners in our practice because we are entrusting our livelihood, our patients to them. Sometimes they're the first person, the first voice that gets our patients, and our last face and our last information that's given to them is our staff. And it's so important that we have great staff because without them, we wouldn't be here.